Hi everybody, my name is Dr. Mena, Lora. I'm an infectious disease expert here at St. Anthony Hospital, and I am excited to talk to you about coronavirus. I've been talking with everyone, my own family members, my patients of course, staff members, so I think it's very important to talk about coronavirus and answer any questions that folks may have. So I've prepared some slides for you, and welcome to Facebook Live. I'm excited to answer your questions as well. So follow me to the screen. Alrighty. So I have made some slides, and I want to have just everybody kind of on the same page about everything, and then hopefully I can answer most of your questions by just going through all of these different slides. Many of you have read already a lot of things about coronavirus, and it's in the press, in the news, so you may know some of these basic concepts, and then we'll move on to other things. So starting with general principles, of course, coronavirus is a family of viruses. We have been infected with coronavirus type viruses for a long time. It's a fixture of flu season. Sometimes we have viruses that are not influenza that cause similar type of symptoms, things like rhinovirus or coronavirus. The difference with this one is that it's not your typical coronavirus. It's not a human coronavirus. It's a coronavirus that likely mutated from some sort of animal coronavirus, what we call in medicine zoonotic, something that comes from animals, hence the term zoo. And in general, if it mutates, if this is supposed to infect an animal, and we're not even sure which one, but some of these proteins just change, then it can change to the point, or mutate to the point where it can infect humans. When this happens, our immune system doesn't know this type of coronavirus. And in general, it can spread and cause some of the things that you've seen have been happening over the past few weeks. This is a normal part of, infectious diseases, in the sense that many viruses, many emerging infectious diseases come from non-human sources. So for example, HIV very likely mutated from monkeys, Ebola very likely mutated from bats and other bushmeat. So this is a normal part of the human condition, where sometimes viruses from other species can come and infect us, and similarly the other way around can happen as well. So now that we have this new virus, of course it has spread quite dramatically. These are updated maps, but of course these maps change by the day as information changes by the day as well. But in general, we started seeing cases in a city in China called Wuhan, where a bunch of patients were having flu-like symptoms, but their flu test was negative. And then all of a sudden they were also having further symptoms like pneumonias and things like that. Eventually, in China, they were able to isolate this new virus. They went straight ahead to try to find something new, because again, this whole concept of diseases crossing over is not a new concept, and it's something that we, in general, try to be as prepared as possible. So as soon as it started fitting that pattern, they said, maybe this is something new, and they traced most of the cases to a food market in Wuhan, what we call a wet market, where there's a lot of alive and dead animals that could promote cross-contamination. You take a dead bird that was next to a dead snake or something, and those fluids then cross to somebody's hands, and the virus mutates, and then all of a sudden that person has a virus that can infect them and other people around them. As you guys know, things started to spread elsewhere in Asia, Korea, Japan, Southeast Asia, and eventually now this map is an updated map of kind of growing cases in the past week. So that's why China is a little bit lighter, because it's a little bit ahead in the epidemic. So it has spread elsewhere in the world, and of course now in the United States. These are the symptoms. So the symptoms are, reported illnesses have ranged from mild symptoms to severe illness. And in general, think of the flu with regards to symptoms. You have viral respiratory symptoms like sneezing, runny nose, sore throat, dry cough, shortness of breath if you're getting a little bit sicker. And then this is for some of the most severe cases. But in general, just feeling tired, just feeling like you have the cold, that's typically kind of the symptom. And by the way, that's why it has spread so easily, because a lot of people have just common symptoms that doesn't ring any alarm, and then it can spread further in the community. And in general, the symptoms are just very similar to an influenza-like illness, of course with some patients developing more severe infections. Now, a lot of this is probably known to you guys, given the fact that it's been in the news a lot. So I also wanted to talk a little bit more about mode of transmission, and we'll talk a little bit about how this could get transmitted. In general, with new diseases, sometimes it's not 100% clear how transmission occurs, or symptoms, or other things. So a lot of this will change by the day. However, we have a pretty good idea of how this transmits itself. In general, it's behaving like any other virus. Viruses typically spread themselves through respiratory secretions, things like saliva and sneezing, and it's what we call a droplet type of thing, where you sneeze, and depending on the size of the droplet, kind of gravity pulls it down. Now, there have been some studies in the past few weeks that show that if you do certain procedures like intubation, then maybe the droplets become a little bit smaller and can aerosolize themselves. But in general, this is not how it has been behaving. You have to do things to make it aerosolize. Like most viral infections and respiratory viral infections, this seems to be behaving in a droplet kind of way. Now, keep in mind, you sneeze and you don't cover yourself, it's going to fall not just to the person in front of you, but to the surfaces in front of you. So it could stay, you could have sneezed on a table, and then somebody's hands grabs that cup, and then they handshake with somebody else, and that person touches their face, and that's really how it happens. We'll talk a little bit more about how some of these different modes of transmission perhaps are a little bit more, more effective with this virus. But in general, here's a picture of what happens when we sneeze. We just don't see this that much, since we don't have a black light. But these droplets, and you can see them by the size just dropping. Bigger droplets means heavier weight, and therefore kind of quicker fall, but smaller droplets means they can travel. In general, we're looking at a transmission of about 6 feet, and that's where you get all of this social distancing stuff. If you have enough separation from somebody that sneezes, even if they don't cover themselves, then you're less likely to be in touch with the droplets. Of course, if you're closer, then that's different. For healthcare workers that are intubating and doing aerosolizing procedures, then again, it could become a little bit more tricky, and that's why sometimes in very specific situations, healthcare workers need different types of masks. I think this is an important thing to talk about, flattening the curve. Flattening the curve is something that we are all dealing with in society, myself included. I have children who are out of school. I have family members who are not working or working from home. So I think it's an important part of talking about coronavirus, because what we are seeing really in society has not had a precedent like this, at least in the past couple of generations. So first thing is, what do we mean by curve? This is what we mean by curve. As the cases rise or fall, curves develop. And of course, we are in the uptake of the curve now as we start seeing more cases in the United States. The curve has been changing elsewhere. So China had the initial curve, and then it started going down. And then all of a sudden you see higher curves in other countries. And of course, now in the United States, we have a rising curve. There's some limitations to this, of course, and the more we test and the quicker the tests become, then of course we will see more cases. These are cases that were probably walking around in the community 3 weeks ago that perhaps would have been harder to detect. So when our ability to find things is better, then of course we will find more. If you turn on the lights, you will see more things. So a key concept of how things can spread is what we call infectivity. Epidemiologists use the term R0 or R0. But the bottom line is, infectivity is how easy is it to give to other people. So I showed you how it gets transmitted, and I want to compare it to influenza, because again, they can be similar in symptoms, but we're dealing with a problem of numbers more than symptoms as well, though it seems like this virus, of course, can also be a little bit more severe since it's a new one. But more than anything, what we're trying to do is to try to reduce cases. So influenza, if one person has influenza, it can give it to approximately 1.2 people. So that means one person will definitely get it and maybe another person. So think about that. My kid who's in daycare, if he has mild influenza type symptoms or a respiratory virus, the chances are he's going to give it to perhaps one other child in daycare. And that kid might give it to another child as well. With COVID, though the methods are similar, you know, you sneeze, it might go on a table, and again, this thing changes, and it's not there's some things that we're not 100% certain about, but it does seem to stay in surfaces a little bit longer, and perhaps that is the reason why there is a higher infectivity. So rather than give it to one person, you're at least giving it to two. But for just our conversation, let's say we're giving it to 3 or 4. Again, this is a new disease, so our numbers as we study it will become better. But this is kind of the big difference. In addition to potentially having a group of people that have more severe infections, it's just the fact that it can give it to more people. That's what we're all concerned about, and why we're seeing so much changes in society with closures of schools and all these other things. In general, this information will also change, and most of this information is based on some of the countries that have dealt with this condition earlier. In general, most people develop mild symptoms, and mild may be really mild or not so mild. And by that I mean you can develop a small pneumonia. You could, develop just a tickle on your throat. And the more you see the news, the more you find people, even famous people, who have been known to be positive or who just got tested. But in general, most people may not need to be in the hospital. About 13% of people do, and then 4.7% may need more advanced care, critical care beds and respiratory care and so forth. Another important thing is who tends to do more kind of poorly. In general, the older you are, this trend has been seen throughout the different countries. Older folks tend to have a higher disease burden. And let me go back to that slide. Older folks have higher disease burden than younger folks. It doesn't mean that younger people don't need it. It just means that we're less likely to have very severe disease. So this thing will change. And by that I mean we're seeing it in different populations. And pre-existing conditions like, if you have lungs that are already affected by smoking, if a certain city or population or country has older folks, all of these different variables can mean that a country could have more or less cases. Now, back to the curve. When we talk about COVID-19 having more infectivity, giving it to more people, the more people you give it to, the more the curve is. And again, we're looking at just 2 dots here, but let's say that it's not 2 to 4. Let's say it's just 1 to 2 people. If you're duplicating things, then 1 becomes 2, which then becomes, 4 and 6 and 8, and all of this becomes pretty big. One analogy that I've seen that I think is interesting is lily ponds. If you have a pond full of water and just 1 lily, and that lily duplicates by 2, then you have 2 lilies. But that duplication, at some point, when you have more lilies duplicating, then you can overwhelm the pond quite a bit. So that's why we're concerned about this curve. We're seeing cases, and we will continue to see cases, but we just have to do everything we can to try to reduce the amount of cases that we see on a single, time frame. The more we flatten this, the more our capabilities to deal with the cases. That's really what all of these public health measures are all about. So going back to infectivity, this is how society looked 4 weeks ago or 2 weeks ago. A person may have coronavirus, and maybe in January this was somebody who had traveled to China or to Korea or elsewhere. But now this person is in the community, and he gives it to his child, who gives it to, 2 to 6 people, and then this goes to another group, and then this goes to another group. And that's how you develop a rise in cases. So all of these public health interventions that we're seeing here is to try to reduce all of this transmission. Because again, we're not looking at 1 to 1.2 like the flu. We're looking at 1 to 2 to 4. And again, we're not 100% sure, but we certainly know that it's much more than influenza. So all of these different groups connecting with each other, that's why we are trying to stop that. Imagine, myself as a healthcare worker, I'm at higher risk of seeing patients and potentially acquiring it. So if this is me and I go home, then, my kid is not 80 years old. He's probably not going to develop a severe illness or symptoms. But by keeping this in my own household, his teachers, their family members, etc., are less likely to get it. So again, all of us, what we're doing is trying to buy time and trying to isolate all of these different units. Again, this thing is quite efficient because it doesn't affect in a super severe way all of the people that it infects. That 80% of people, if they go to their church, banks, schools, then of course you see a multiplying thing. However, if we're all in our individual silos, that curve that I mentioned, will happen in our households. Just little curves, not big curves. Sorry, my pen stopped working. So little curves rather than large curves. So, moving on next, I want to emphasize that all of this is a new virus, and this is all new for many of us. How much cases and how this has spread so quickly. But this is really a part of the human condition. And in this slide, this is looking at how social distancing and locking down on large groups really helped during 1918 when we had a similar virus. That virus might have been more dangerous. Also, that virus was much more dangerous and spread quite easily. So ultimately, in Philadelphia, they implemented all of these social distancing measures. In Philadelphia they did not, versus in St. Louis they did. So the curve is much different. Healthcare systems had to see a lot of patients in Philadelphia, but not so much in St. Louis. And this works. We don't have to go 100 years ago to take a look at this. We can just look at how China has done. If you look over here, the cases started to drop as soon as China implemented quarantine measures. So that's really what we're doing. We're doing this for our society, for our grandparents, for your neighbors' grandparents, and for everybody else. So a little bit more on COVID and you. The first thing that I want to mention is that hospitals are prepared. Hospital preparedness is not something new. It's something that we do year-round. We prepare for any sort of infection or even other things, from tornadoes to everything else. So we practice this, and we've actually had similar conditions recently, from H1N1 to Ebola. So we prepare for these things. Emergency preparedness training is a year-round activity that is done with each facility and system, and we work very closely with public health departments. So moving quickly to other important points. What can you do at home? Well, just remember how this transmits itself, right? So cover your cough. If you have any sort of mild symptoms of anything, try to separate yourself even more aggressively than you would have otherwise from your family members. But otherwise, just try to keep distance, wash your hands a lot, wash surfaces that you touch a lot, cover your nose, and try not to touch your eyes and mouth a lot. Because again, you may be feeling fine, and then somebody sneezed on a table that you didn't realize, and then you put your hand on the table, and then you scratch your nose or your mouth, and that's how this happens. So wash your hands, wash your hands, wash your hands. Another important question is masks. These are just the different masks. The actual name for this mask is a surgical mask. It is meant to keep things in rather than protect things from coming out. So this mask is mainly for surgeons. It does have a role for healthcare workers because it protects their mouth from droplets coming in necessarily, but the air still moves around a little bit. So there's a lot of different protections, and ultimately a lot of people are walking in masks, and that's okay. I think we have to use them a little bit more judiciously, and the most important thing is wash your hands. These masks are primarily for healthcare workers when they're doing intubations and other aerosolizing procedures. And overall, we want to make sure that we use these when we need them. Protecting your eyes and mouth and all of the things that I mentioned. I don't want you to scratch your eyes. I also don't want a patient to sneeze on me when I'm talking to them. So this glass is mainly to protect my eyes, and the surgical mask is meant to protect my mouth and my nose. And also, people scratch their hands, scratch their faces a little bit less when they have some of these devices. But washing your hands, and washing your hands is the most important thing. And again, by doing so, we are keeping our family safe. And then by not going to school and trying not to do things like playing basketball where we touch a ball that touches a million other people, these are the things that we can do at home. Our Department of Public Health has great information as well. And I put some of the most important ones here. So who's at higher risk for severe illness? We mentioned that. Older folks and people with pre-existing conditions, particularly lung disease. And should I go to my doctor and get tested? In general, we assume that this has been in the community for some time, for a few weeks. And in general, we have to make sure that we isolate ourselves. If you have more severe symptoms and you should see a doctor, you should call your doctor first. Of course, all of our healthcare system is mobilized, so people who need to see a doctor can do so. And ultimately, separating yourself from others is key, especially if you have any symptoms whatsoever. And these are some other things from our Department of Public Health website. Cleaning your hands often, avoiding sharing personal household items, cover your coughs and sneezing, monitor your symptoms, and always call ahead, because you don't want to be febrile and waiting in a room, or vice versa. You don't want to go to your regular diabetes appointment and have other folks there with potential things. So with that, I'm sure I went a little bit over, but I wanted to put some of those points, and I know that we have some questions coming in. So first question that I have is, should I move over there? Or? Okay, 1 second. All right. So based on your experience, do you believe social distancing will continue? This is something that our public health officials are going to work very hard to calculate. As I showed you guys, our experience in 1918 and our experience recently in Wuhan, China, and Korea shows that social distancing works. This virus has an incubation period of about 3 days. People then develop symptoms for about 7 or 10 or 14 days. So ultimately, if we had very strict isolation means, then we would contain this quite dramatically. But ultimately, that's a question that is more broad picture. Our public health authorities are doing calculations every day based on the tests that they're getting to see what measures they can recommend to our governors and our elected officials. What I will say as a physician, as an infectious disease doctor, is that social distancing works. It worked in 1918 when we had less of an understanding from it, and it worked in 2020 in Wuhan. When should I consult my doctor? That is a great question. I think, we have to socially distance, but it doesn't mean that we have to block ourselves from everything. You have to know if you need help. And all of our healthcare facilities, ourselves included, have systems in place so you can talk to your doctor and say, hey, this is what I feel. And then your doctor could give you more instructions based on the information that you give them and based on your comorbidities, your other health problems. So for example, if you have chest pain and a cough, but you're a diabetic and you have other things, we want to make sure that's not a heart attack. Though our society is somewhat paused because of the social distancing measures and quarantine measures, our bodies are not. And you still have medical problems, and all of our healthcare facilities are here to still help you with your infections and heart problems and all these other things. Over the next few weeks, public health officials have tried to limit clinic activity and other things, but in general, you should still be able to talk to your doctor and figure out what the next step is for you. So if you're not feeling well, by all means call your doctor. You can also talk to your clinic or go to the emergency room. Because again, we don't want people to not seek care. We want people to seek care, and then we will triage them to the right area depending on what their needs are. So are hospitals, and is our hospital providing testing? Yeah, and you've probably seen the news how testing capability has been limited over the past few weeks, but will continue to expand over the next few weeks. Trust me, as a physician, I want to be able to test this, and get a result right away. The capabilities of doing that are improving dramatically. our usual lab that we work with is able to test. But ultimately, who gets tested is a question between the physician and the patient. We have to make sure we test people that, if you come in again with chest pain, then maybe what you have is a heart condition rather than COVID. Similarly, if you don't feel very ill, public health authorities are recommending that, if you have just a throat tickle but you don't have shortness of breath and things like that, still call your doctor, because he's the one that's going to tell you what to do. However, there is a role for you just protecting yourself at home and then coming to seek healthcare if you don't get better. Similar to what we do with the flu and with other conditions. But again, I think that's more of a question between you and your physician. Should I come and get seen? And also, should I get tested? So in general, a question here is, how is mother-baby being protected and the delivery unit? I will answer that in a more even broader way. Ultimately, our role, and my role in particular as an infectious disease doctor, is to evaluate and treat the patients that or may have this infection, but also doing so in a way that protects myself and protects my colleagues and protects other patients as well. So throughout the hospital, we've developed systems where patients are identified, and these are patients that essentially have some of the symptoms that I mentioned. The turnaround time for the testing is a few days, and that'll get better. So in general, we have to identify these cases and create a system to be able to deliver the same, high quality and compassionate care that we would in any way. So all of the units, mother-baby included, have systems in place where if you have symptoms that could be COVID, then you will be in a special place and in a special unit that will take care of you with special needs. And if you don't, then you will be in a different place, receiving the same compassionate and high quality care that you would get otherwise. Great questions. And this is, so average time before symptoms show. This is something that I've told my parents. Again, these are big changes, and I think it's natural to be afraid. I think we have to just read up on stuff and feel comfortable with the information at hand and take all appropriate measures. Average time before symptoms show is something that I always tell my parents, because I do think it makes them much more comfortable. As I mentioned earlier, it takes about 3 to 4 days without symptoms, and then you start developing symptoms. So on day 4 or 5, you will start having an influenza type illness, and that lasts about 7 days. As a healthcare worker, I know healthcare workers in different places and family members as well who have been in touch with this or similar viruses, and most people do well. They just stay at home and they have these fevers. But again, those 3 or 4 days, if you've been washing your hand aggressively, or start a clock right now and wash your hands aggressively and distance yourself from others, and once those 3 or 4 days pass, then you should be okay, because it's around 4 days of incubation. So when I told that to my parents, they were like, oh yeah, I feel it's been 4 days that I've literally washed my hands every hour, so I think we'll be okay. That's a great question. All right. I think I have most of these answered. Thank you. So what is the risk in any little village hospital? Is our community being taken care of? Great question, and I this is what we're here for. I think as an infectious disease doctor, I want to be out there answering questions and making sure that people understand that they are being taken care of. When I was talking about hospitals and how they prepare, this is a year-round exercise. We, of course, could not predict that COVID was coming, but we practice for any number of things that are at an emergency level. So other diseases and other conditions. So hospitals work very closely with the CDC, our public health officials, to make sure that we have everything in place. And here at St. Anthony Hospital, for example, we have a special unit where we deal with respiratory illnesses. Our hospital, of course, is still open for everything else. We have people still needing acute medical care, and we want to make sure that you do seek care if you need it. We want people to stay home, but we want people to seek care when they need it. So I can assure you, speaking for my other colleagues, the infectious disease community is a very friendly community, and we all talk to each other. We've been working very hard, and all of the hospitals are doing similar things. So everybody, I think, is ready. And our community here in Little Village and in Pilsen and elsewhere is certainly ready. Now, how much virus do we have in our communities? That's something that our public health officials are working on. The more we test, the better idea we will have. But ultimately, if you develop any problems, we are here for you. And when I say we, I really don't just mean St. Anthony Hospital. I mean all of us. We're here to help you.
Last question.
So we are going. So if you can, just continue asking questions, and we will continue answering on social media. So thank you so much, and I hope I was able to answer your questions and make sure that you feel comfortable and understand all of these changes, because these are big changes, not just for us in healthcare or here in our hospital, but from a society standpoint. So thank you.